Hey guys, welcome back. So today we'll be doing the second video on the FAQs on breast reduction. If you haven't seen the first video to see the first 4 questions, go check them out. Today again we'll be dealing with some very common questions that we get asked. I'm Dr. Saumil Shah. I'm a plastic surgeon, director of plastic surgery at Skinzone, Borivali, Mumbai. So downtime is different for different individuals. Why I say this is very simple. We do breast reduction surgeries either as a daycare if it's a small case, or we can even keep you overnight if it's a longer case where we've done major reductions. We may ask you to sort of not do a few things in the initial period. We'll be giving you a pressure garment, a bra support, a bra which sort of supports your breast tissue in the initial period and does not sort of let the dressings and the stitch lines to stretch. There will be no restrictions from the point of view of going about your daily activities like sitting on the dining table and having food, resting, doing all your daily chores on your own, sort of moving around your house and all of that. There are no restrictions. If somebody has a desk job, we usually tell them to take a break of between 5 days to 7 days from the job, and they can resume. If it's work from home, they can resume as soon as they're comfortable, even maybe from the second or third day after the surgery. If it's a job that requires field trips, you need to go out, you may need to take a break of anywhere between 2 to 3 weeks, depending on how well you heal and how comfortable you are and what your job demands are. If you're someone who is into gymming and who likes to train a lot, who is doing a lot of physical workouts, who's lifting heavy weights, then you'll need to wait for 4 to 6 weeks after the surgery for that healing process to have been. So this is what the downtime is like after a breast reduction surgery. This is a question that a lot of patients have in their minds, and it's something that some surgeons also offer, some plastic surgeons also offer patients. I personally do not feel like doing just liposuction for a lot of breast reductions because, especially for the breasts which are sagging, they can make them more saggy. Because you can think of breast as being like a balloon, and if you sort of deflate the balloon a little bit, under the force of gravity it's going to fall even more. So that is why I don't like doing liposuction in the breast per se. Also, the breast is not just made up of fat which is removed during liposuction. There is also glands which, if damaged, can cause some problems. So again, I don't like doing liposuctions for these reasons for the breast. However, we do include liposuction for women who have a lot of fat, maybe on the side of the chest or in the underarms, along with breast reduction to give a better shape to the breast. So, liposuction per se, I do not use for doing breast reductions, but I do include them in patients to help with the better shaping of the breast. Post-operative care for breast reduction surgery is quite simple. There is not much. You will have a dressing. You will need to keep this dry. You cannot take a bath till your stitches have completely healed. You can do sponging and take a bath below your breast level. You will be asked to wear a supportive bra that you need to wear for anywhere between 3 to 4 weeks till your breast sort of completely settles. After the surgery, we might ask you to sort of be careful to not sleep on the front of your on your chest if you are used to doing that for a few days till the wounds have completely healed and till the pain and the swelling has settled. If we are adding liposuction to it, we might ask you to massage in the areas where the liposuction has been done. So these are some of the basic steps. There is nothing much that is relevant to post-op care in breast reduction, unlike other surgeries. So this is a question that a lot of patients ask us: what is the approximate cost of breast reduction surgery? Now, breast reduction surgery, one thing is if you have major issues such as a lot of neck pain, bra strap pain in your back, upper back, lower back, where you're carrying upwards of 3-4 kgs on your chest. And if you have a mediclaim, we may ask a mediclaim provider if they are going to help you out because you have physical problems of your heavy breast. Sometimes they do, sometimes they don't. You need to sort of talk to your agent about it. We can give you the relevant paperwork as to ascertaining that you have these issues because of a large breast. When it comes to the cost, if you don't have a mediclaim, and it will depend on a lot of factors. First is what kind of breast reduction and how much breast reduction needs to be done. Second is what is the technique we are using. Third, where we are doing it. Fourth, if there is any other extraneous costs associated with it, or you have any other risk factors that need other major hospitalizations or other doctors' involvement along with it. We'll also be sending the tissues that we cut out for biopsies, which also is a sort of a small cost that is associated with it. So all in all, the cost of breast reduction surgery is something that is very customized as the surgery itself. You can consider it might go anywhere between upwards of 1.2 to 1.4 lakh for a small breast reduction, to anywhere up to 3 to 4 lakhs in a bigger hospital for bigger breast reductions. So for the exact cost, you'll sort of need to come and meet me or your relevant plastic surgeon to know where, why, what is the cost of breast reduction like, and where it's going to be done, and why sort of the cost is that. So the cost is something that will vary a lot. So these are the most common questions that we get asked. The first part and the second part included about 8 questions, and I tried to answer most of them a bit more in detail so that more questions were covered. If you still have more questions, do get in touch with us. You can consult me or just give us a call or drop in, and we'll be happy to help.